I'm Molly, student nurse. Can I have you verify your name and date of birth? Good, and then any allergies? No, okay, I'm gonna provide for privacy. Sanitizer when I got in the room. So we're gonna go ahead and clean up our bedside table. So I'm here to do a dressing change for you. Let's go ahead and clean the table. Any pain or irritation at the site? Good. Okay. Let that dry a little. Okay, so we're going to assess a few things before we get started. So I see we do have an implanted port. So I'm looking at the site for any redness, swelling, exudate, any pain, tenderness, warm. Temperature is nice and warm, it's good. Patient did not complain of any pain or tenderness. And I don't see any inflammation or swelling. I'm also checking, I noticed there is a biopatch in use. If there was a stat lock in use per the policy, I would see that as well. I'm looking at my tubing, posi flow is intact. If it was hooked up, I'd make sure everything's intact, running well. Everything right now is intact, it's saline locked per the order. And so then we're ready. I'm looking at my dressing. This would be dressed. For practice purposes, it's not. And I would be seeing how the dressing, if it's bloody or what's going on. It is not bloody, so I'm actually throw it right in my garbage here. So we're ready then to remove the old dressing. So the thing with dressing, you want to make sure big time you are not pulling that needle out of the port. So you could secure it with tape ahead of time just to keep it in place. If it's giving you trouble, you can alcohol the corners, rub alcohol pad. And that helps to loosen, help that come off. You would never use a scissors. You could accidentally cut the port. So let's say I'm removing it, making sure to not remove the needle, get that off. So now I'm going to shimmy off my bio patch. This is done, so garbage. So then we're ready to set up our sterile field. Okay, so my equipment then is the central line dressing change tray, expiration's good, and my bio patch. So let's go ahead and open that up. So I have my sterile gloves. I am actually just going to set aside for right now. Mask, we would mask the patient. And I already have my mask on. Okay, so let's open our kit here without going over the sterile field. Okay, and then before I get started, get my gloves, I want to get that bio patch on the sterile field, which is just a flip. Okay, so now I'm ready for my sterile gloves. So I want to make sure always that I'm not turning my back to my patient or my sterile fields. Okay. Keeping my thumb out. Get those gloves on. Keep them above my waist because they are sterile gloves. So now we're ready to clean. So I'm going to have my cover prep. I would snap. And we're going to do 30 seconds watching my wedge horizontal. And we can even kind of loop that up, making sure we're not lifting it out. A little bit more difficult with the tubing here, but and using friction. Very important we have this clean. We want to make sure we don't cause an infection. Okay, we're ready for vertical 30 seconds. then we do our best for concentric circles. Okay, and lastly, we clean the tubing here. Maybe press it down secure. Using friction. Try and get under there. Okay, site is clean. I'm going to drop. Go ahead, let's grab our new bio patch with blue to the sky. Okay, and then we're ready to dress the site. If we had a transparent dressing, that we put transparent dressing on, and then the shirt and dress, and making sure the notch goes, or the tubing goes in the notch, not to cover the nipple. And we would then dispose of our supplies. So I can actually hold this up. So we'd have, for practice I'm not going to, but we do transparent dressing, get that on there, and we would document how the site looked, how any patient complained of any pain or tenderness at the site, and that we did put new dressing on. And that'll be it.